say, and however you want to tie that into.
Yeah, go for it.
Yeah.
I'm Elizabeth Berg, and I'm an RN case manager with the Visiting Nurse Association of Cincinnati. And this is my patient, Thelma Stone.
And Elizabeth has been so much help to me. I went to the hospital in an ambulance on March the 14th and came out 9 days later with 2 stents in my heart. They gave me about 9 prescriptions when I left the hospital, and I had no more idea than the man in the moon what those were or what they were for other than my heart. And Elizabeth came, I think, within, she called me the minute I got home, and I was so confused. I said, no, don't come yet. So she came, I got home on Friday, I think she came on Monday, and we started our routine. She took my blood pressure, all my vitals, and gave me some ideas about what I could eat, what I couldn't eat, on a low or no salt diet. And she's just been wonderful. I couldn't have done without her.
Great.
She's done everything for me as far as helping me with my health and keeping me from going back to the hospital. That was the main thing.
And can you say what you went into the hospital for, Thelma? What happened?
I had heart failure.
You had heart failure.
I should have put that in first.
That's okay. We can edit. I mean, so we can,
Yeah.
And we had a wonderful relationship with Ohio Heart. They just made this whole process so much easier. We were able to communicate with a nurse practitioner and with Dr. Menon, and we could coordinate problems with medication. We had to change them a couple of times because as she got better, she needed less of some medicine. And as we got her diet more articulated to what she could have, then medications needed to be changed again. And then she was ready to be discharged because she was independent. And now she's out, going out to eat with her friends and shopping and doing all kinds of things. Driving. And she knows what she can eat when she goes out. We set up some plans for her, what she can eat.
Labels.
And she reads labels.
Yes, that's good.
That's
Very
great.
good.
So all those things, Elizabeth helped with all of those things as you were going through that
As I
process.
said, I couldn't have done without her.
Yeah.
Especially with all the medications. She made a list for me and what each thing was for, so I understand it more.
And she keeps a written list in her own handwriting so she can understand it and read it easier. She takes that with her each time she goes and sees the doctor with all of her weights, and so they can keep tweaking things as they need. But Dr. Menon was very pleased the last time she was in.
Oh, that's
Great.
wonderful.
Great.
And how does this relate to basically, your other patients, and this is typically what you do, and
This is exactly what I do. It's giving the patients back their independence through education, through some simple tools that we can use to make life easier with diet, with logging blood pressures, blood sugars, weights, and all those things, communicating with the doctors. That's the most important thing. Patients don't think that they're allowed to call their doctors and say, hey, I have a problem. So, we have, her nurse practitioner even gave her her personal number to call. So we really opened up some excellent lines.
Great.
And instilling our patients to be independent and take their life back.
yeah.
Great. Great. Thank you.